Thank you all so much for joining us and for attending our FJI this morning. It is not your typical HIPAA training. So I thought that would be more enticing to get people in. We hear about HIPAA all the time, but this one, I promise, will be so much different, so enlightening. We have our wonderful presenter, Miss Emily Zahn here, who will be presenting. Emily is Vituity's Chief Compliance Officer and the Senior Vice President of Compliance. She oversees all aspects of Vituity's compliance program, including incident management, awareness, and training, the release of information, HR compliance, and coding compliance. A very, very strong background. As the Chief Compliance Officer, she facilitates a culture of accountability across Vituity and is committed to improving and protecting our patients, um, fellows in Vituity. Emily received her Bachelor of Arts at Princeton University and her law degree from the University of Louisville Brandeis School of Law. As you know, this is a FJI, so we thank you again for attending. Please remember at the end, we will send out a survey. So please, please, please complete the survey so we can get your feedback and so we can continue bringing you amazing and informative FJIs. We get a lot of attendance to these, so your feedback has been so helpful to help us grow. And special shout out to our executive director, Ms. Susan Kim of the Family Justice Center, as this has been her amazing idea to create these spaces where we can continue to learn and grow in the work that we're doing. Um, this message, who am I? This recording will be recorded. This webinar presentation will be recorded and we can share it with you. And if there are any slides or information Ms. Emily has that she can share, we can forward that all to you all at the end of this training. We please ask everyone to keep their selves on mute and we will hold questions. Now, if Ms. Emily is open to questions at certain points throughout her presentation, she will let us know. If you have questions and want to put them in the chat, I will keep an eye on them and make sure to uplift them to her so she can answer them as best she can. Thank you. And again, my name is Lashare, and let's get started. And let's give a virtual round of applause with I love the claps. Thank you. Presenting Miss Emily.
Great. Can everybody see that? My screen? Awesome. Great. So thank you so much for the nice introduction. What an impressive audience that I get to speak to today. So I'm excited about the community that you represent and so pleased to be here. I've been at Vituity for 9 years. They're pretty amazing years. And it's through Vituity that I met Dr. William Francis, who introduced me to the great work of the Family Justice Center. You're a great community partner that we get to work with. The work they do together is so inspiring that they could probably cover their own talk, but I'm going to be here instead to talk about HIPAA and privacy. So I hope the topic is not too dry. I tried to make it a little bit more interesting and hope it's relevant for you guys. Okay, thanks also to Marta and Lashare for helping coordinate the event and getting me all set up here. So I just want to put out a disclaimer before we get started, right? I'm an attorney by training and prior practice, but I do not represent Vituity as counsel, and I'm not able to provide you any legal advice to you specifically during this call. However, I'm able to share some tips and best practices and things that have worked for Vituity and our partners. So this is what we're going to cover today. I'm going to tell you a little bit about what Vituity is, who we collaborate with in terms of community partners and the types of community partners we partner with, privacy laws affecting California healthcare providers and their partners, some industry news that might impact you, and then, let's spend a little time talking about navigating the exchange of PHI between providers and social services and different community partners, and I'll give you some resources that you can take away with you. Protecting clients is at the core of what we do. It's also at the core of what me. Can you still hear me? I got muted, I think. Okay, sorry. So compliance makes more sense when you think about protecting patients, protecting clients, right? There's paperwork, there's safeguards, there's forms to fill out. It seems like a lot of administrative stuff, But again, if you focus again on protecting patients and doing the right thing for them, it really starts to make more sense. So let me just get started here. Let me tell you a little bit about Vituity. I'm having trouble clicking. Okay, here. Our mission is to improve lives. So that's really our why. We're a partnership that's been around for 50 years. And so our just cause is to improve as many lives as possible for as long as humanly possible. And what we do is we work in emergency rooms, hospital wards, urgent cares. We do specialty work with anesthesia, urgent care, neurology, psychiatry, and critical care. Everything we decide to do and innovate on is really driven by our patient-centered focus. I like that a lot of your mission statements talk about client-centered focus, and protecting patients is at the heart of our compliance culture. So I also wanted to highlight that we have a Vituity Cares Foundation that we're very proud to support. It really focuses on addressing care for vulnerable populations, empowering the underrepresented, and ensuring a more equitable future for all. Specifically, the foundation does a lot of interesting projects. One that I volunteer at is our homeless clinic. And we have them all over the country. I work at the one in Orange County, and it's a wonderful thing to see when you can provide general health care, prescriptions, food, toiletries, clothing, and then I love that we give haircuts. A haircut is a transformative thing, right? So once a month, if we're giving a haircut to someone who doesn't otherwise have access to that, it is really a life-changing, face-changing, the smile that comes off their face after they have a haircut is pretty inspiring. So I love to be a part of that. So again, Vituity, we're treating 8 million patients annually in about 600 locations around the country. And we have over 9,000 Vitans. It's a Vituity physician, employee, people who support our organization, over 9,000 folks. So we collaborate with the community in many different ways, right? Two programs I wanted to highlight today that I know this group works with is Greenlight. It's a program to work with all Contra Costa County healthcare access points, just to ensure that survivors of violence have the same access to county resources regardless of where they present for care. So that's John Muir, Sutter Emergency Room, emergency medical service or ambulance services, et cetera. And then our telecare program that we support with free low barrier access to high quality healthcare for survivors of interpersonal violence. That's medical, post-trauma, psychiatry services. Vituity is also engaged in other community partnerships, not necessarily in Contra Costa County, but in other counties as well, and in other states. We work with housing projects, clinics for the homeless, empath units, EMS, ambulance collaborations, critical access hospitals, rural health initiatives, wound care, and wellness. So we have a lot of experience working with different community agencies as we try to deliver care in new and novel ways. During COVID, we really tested that, right? We could give care out of a bus. We could do telehealth into, a tent. We're trying all sorts of things. So they really test my compliance skills when they come to me and say, hey, can we do this? How about this? Can we try this? But it's nice work to do. So we're so grateful for our community partnerships, right? We have so many folks here on the call and in the community that we work with. And so we're very pleased to thank you for your collaboration. We love working with you. These are just some of the names of the people that we work with in this area. And there are many more community agencies and partners, obviously, that we work with. I looked at the list of participants, and many of you are people that we work with on a regular basis in many different other capacities, so it was great to see your names out in there. So what are we going to talk about today, right? Compliance is a pretty big topic, so I'm going to focus on privacy. I'm also going to talk about how we work with community partnerships. So, compliance can play a role in ensuring that you provide healthcare to vulnerable populations in a very safe way, right? Specifically, I'll talk about telecare because it's an organization that accepts referrals from many sources, right? So schools, hospitals, EMS, attorneys, mental health professionals, and case managers. That does also mean that there's data exchange, right, in all these different communities. So it's sort of a unique relationship. Also, referrals are going back and forth, right? They're all going through the Family Justice Center, which is sort of the host agency. And so all the patients that we see are also clients at the Family Justice Center. So that creates a unique relationship as well, right? And this patient-centered approach is really important to give access to all the different resources that a patient might need. but it does introduce privacy and HIPAA concerns to the mix. And so that's what we're going to talk about today, right? How do you navigate in that environment? It can be very challenging, but there's some great opportunities for collaboration. And again, recentering back on focusing on protecting our patients and our clients and their data. So let's talk a little bit about, HIPAA and patient privacy. I'm going to start on a quick primer. Some of you may be a lot more experienced in HIPAA than others on the call. So I'm just going to level set a little bit so that everybody can participate in the later discussion. I just want to lay the foundation for everybody. I'm going to start with a couple things in the news. Why does it matter that we're worried about privacy? Well, healthcare data is under attack, right? Ransomware and hacking are the primary cyber threats in healthcare right now. In the last 5 years, there's 256% increase in large breaches investigated by the Office of Civil Rights, right? The numbers are pretty impressive, the percentage of increase, but the number that really scares me is the number of individuals that have been impacted, right? Last year alone, it was 134 million individuals were impacted by healthcare breaches. That means their data was compromised, their data was taken or used in an improper way. And that's a 141% increase from 2022. This data is actually released just a couple of days ago. It's a letter from the Office of Civil Rights in response to the Change Healthcare cyber attack. I think many of you may have seen it in the news, right? Change Healthcare had a major healthcare breach. It's the largest the industry has seen. And it impacted pharmacies. People couldn't get their prescriptions. Hospitals had to go to paper. EMRs were shut down. Provider groups were not able to get their cash. Payers were not able to pay the cash. Clinics, couldn't operate. And then there are other impacts to, obviously to the individual patients that were impacted by all of these systems not working. Change had to pay 22 million in ransom in Bitcoin on the dark web. Sounds like a spy novel, but it happened. They are now bringing their systems back online. Pharmacy is back online. Claims are starting again next week, and money will be paid out this week. So for a lot of folks, though, this really shut down, a key sector of our industry. Healthcare delivery really was impacted, and providers were mortgaging their homes to pay their their physicians and their staff. Lots of really big impacts. So this is scary stuff, and folks are still recovering from it. And now OCR has opened an investigation. I've linked the letter to their comments about the incident. But the data in 2023 was also not good, right? The average healthcare breach cost about $11 million. Average downtime was $137 for a big organization. For a small group, it's $427 a minute. Think about the impact of that downtime on operations, right? It's completely disabling for a smaller operation. It's disabling for a large organization, but you have less backup, right? So if you had to be down completely on all your comms or your systems, think about the impact to your operations. Average healthcare record cost $182. If someone steals your credit card, that happens, right? You get a notice from your bank and you get a new number and you get a new card in the mail. And then they can do that 20, 40, 50 times, right? But if you get your medical record stolen, you can't replace that, right? It's your personal record. It cannot be swapped out. Even if a number on a health insurance card can be changed, your personal medical data maybe have been compromised. And your data in your medical record includes not just your diagnoses and your health information, but also demographics, social security number, financial information, right? Physical address, a lot of information. So again, these are some of the big data points. I'd also like to highlight that some of the settlements that have happened also punish companies when they don't do things like secure consent, right, on an app. So, or you fail to have adequate systems in place to protect your data. So these are all things that really matter. And again, the Change Healthcare incident, I have a quote at the bottom from the American Hospital Association. Change Healthcare cyber attack is the most significant and consequential incident of its kind against the US healthcare system in history. Again, so many systems were impacted by that. We don't want to be in that place, right? So we want to protect our PHI. We don't want to open up ourselves to a potential healthcare breach. So privacy laws and of course regulations have tons of acronyms, right? So we spend some time talking about the alphabet soup of privacy laws. I'm not going to focus on things like FERPA, the Family Education Rights and Privacy Act, GINA, or California Privacy Rights Act, CPRA. Those are other regulations. They could deserve their own talks. They have other requirements. You may already be beholden to them. I'm going to focus on HIPAA, and then COMIA in California, the Confidentiality of Medical Information Act also applies, and a lot of that is overlap. So I'm going to focus on HIPAA today. Okay, what does PHI stand for? Hopefully folks know what that is, but if you don't, it stands for Protected Health Information. The other thing I like to remind people, HIPAA is not a female hippo. So it's 1P, HIPAA, right? Health information, right? If we'll go back, Healthcare Insurance Portability and Accountability Act. So make sure you have 2 A's in there and not 2 P's. When we talk about HIPAA, we've got privacy and security rules to think about, right? The privacy rule focuses on use and disclosure of individuals' protected health information. And then it also gives some standards and rights to patients on how they can have their health information shared and used. The security rule is more focused on how do you secure PHI, right? Administratively, physically, and technical levels. So that means physically, if you have PHI in your physical space, how do you secure that? And then on a technical side, in your systems, you can partition data also in your systems, right? So again, what we think about when we measure risks on privacy, we think about what's the right balance, right? You want to be so strict that you can't release information and patients can't get health care, right? You have to have some sort of balance there. So there are permissions on how you disclose, and there's a right way to do it. And then you have to balance that with need and other important purposes. So again, we're going to talk about some of the reasons why you might be able to disclose in an emergency for public health need, et cetera, okay? Let me talk about PHI generally. These are the 18 identifiers for PHI, commonly described, identifiers that are accounted for when you talk about, do you have any PHI? You also can have PHI or a breach if you can identify a patient, even though it's not one of these factors, right? If there was a big car accident and it was in the news, people might know who that patient is if you reference the car accident, right? They might know a celebrity. They might know someone who's, age is one of these items. Someone's really like 90 years old. They might be recognizable because there aren't that many patients over 90 years old, right? So there's other ways to identify a patient. These 18 are the most common, but again, if you could identify them, it could potentially cause a HIPAA breach. The other concept I want to cover is minimum necessary. Again, you only should have access to the minimum necessary that you need for the purposes of your job. So a patient record might be this huge stack of charts, right? But you actually only need maybe a little bit. Maybe you need one chart, one visit, maybe even only need one data point, right? I talk to teams a lot about, well, you're sending a report and you have this big spreadsheet, and sure, out of your database, you could pull every data element that's available, including diagnoses, social, et cetera. But actually, for the purpose of your report, you may only need to have an account number, a date of service, and maybe a few other data points, right? And that's all you should give to the other party. So as you work on PHI in various manners, make sure you're looking at the minimum necessary that you need for your particular role, but also for your particular report, function, little tasks that you're doing. Oftentimes people like to give you everything. You actually don't want everything. You want to kind of narrow that down. Okay, so HIPAA violations. Let's talk a little about the most common ones that get penalized. We're human, so people make mistakes, right? But some of these are totally preventable. So I want to focus on that, right? People are going to mail things to the wrong place. This, improper disposal. They might throw things away in the wrong place. Those might be human errors. But some of these, like snooping, is preventable. We don't allow it at Vituity. Hospitals don't allow it. You can't snoop on a record. So if you have a family member that you want to see, well, what did their lab results look like? You need to have their authorization to do that, right? You need to have their consent. You can't snoop because some celebrity walked into your facility, right? You can't snoop because your ex-boyfriend has a test result. You want to know. These are not things that are acceptable. If you look at 2 and 3, it's talking about risk analysis, right? Part of what we're talking about today is to identify risks. And part of what they'll judge you on if you have a HIPAA violation is did you adequately assess your risks in your organization? So we'll talk a little bit about how do you do a risk assessment. What are the things you should think about to make sure you're protecting your PHI? It'll make a difference in the penalties they might apply, right? Making sure you give adequate access to your patients. If you have a business associate agreement required, you need to make sure you have that and that it's HIPAA compliant. Encryption, system controls, ePHI access, passwords, all of those things are things that are about control of the system and limiting access. And then we also have a deadline it's an administrative deadline to issue a breach notification. You've got 60 days. So those are the common reasons why people get penalized. I talked a little bit about disclosure. We're going to talk a lot more about that later today. Things that are impermissible and things that are permissible. And then I'm going to talk about trash. Every compliance person has a trash story because people dispose of PHI in an improper way. So I'll talk about that in just a second. Okay, there's a duty to report under HIPAA. So if you're a covered entity, you're obligated to track breaches in a HIPAA for HIPAA. Anything involving 500 or more patients requires immediate notification to the government and publication. And many of your contracts or California law might have a shorter reporting period. California's got 15 days. And then every employee must safeguard PHI. So you're responsible for reporting concerns and errors and violations. And really that you needed to have that culture of duty of report so that you can fix things that aren't working, right? Fix things that are wrong. I'm going to point out in the penalty structure at the top, if you're taking reasonable efforts to kind of address the situation, the penalty is much lower, right? If you go down and you totally don't care, you didn't bother fixing it within 30 days, they're going to fine you a lot more. So again, just seeing that is helpful to kind of get a sense of what we're talking about in terms of penalties. Okay, I'm going to take a quick pause. I'm going to go into tips on protecting PHI. Do we have any questions right now on those? There's kind of background information so far. I can't see the chat, so
None in the
none so
chat at
far.
this time.
Okay, great. All right, so we'll go on to tips, right? How do we protect PHI? These are some really common things to do that are really easy, right? You're going to fax records a lot. Unfortunately, the government's pretty antiquated. They don't allow you to do a lot of things. Mail and fax and FedEx are their approved methods. You can also do some emailing and of records if it's encrypted and you have certain safeguards in place. But the thing that's common is that you mistype the number, right? Or you send it to the wrong address, or you shuffle the papers and you get the wrong person, right? Or you give them too many pages. So my common mantra, and I say it all the time with my team and with Vituity folks, is verify, 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 right? You verify the fax number when you start, or the telephone number, or the email address, right? You use a cover sheet, you have a confidentiality statement. You want to make sure that if it goes to the wrong person, they know who to call. You confirm that you entered it correctly, and then you also need to verify receipt. The other thing that people do that they get a HIPAA violation for is they let their faxes stack up, right? Then they have all this PHI stacked up on a fax machine, and then other people can grab it. That's a dangerous thing. Same with mail rooms, right? To be careful how your mail comes in. If you have sensitive information in your mail, who's handling the mail, how is it secured, et cetera, right? You don't want it in some common space. Social media is another area that has commonly been an issue. PHI should not be shared in any format on social networks. Be really proud of the work that you're doing. Make sure your background does not show a screen that has PHI on it. Like, people don't mean to do it, but it happens, right? You might have patients in the review, and you make sure they have consent, right? You don't want to put any information about a particular patient. Again, when we talked about the identifiers, if the situation is noteworthy, or the situation the patient can be identified from the story, that's enough. Even if you don't name them, you don't use their MRN number or something like that, right? That information could still be identifiable. So now I'm going to tell you my trash story, right? Everybody has a trash story. So PHI really has to be disposed of daily. If you have a shred bin, it needs to be securely locked, and it needs to be managed in a very, regular manner. I worked at a billing company before Vituity, and we had a nightly janitorial service. We had a lot of PHI at the time that was physical. We had a lot of claims by paper and things going out, and we were not fully electronic as we are today. this risk has gone down significantly. But we changed cleaning services, and we had used to mark everything in Spanish for the group before, and they switched to a team that only spoke Vietnamese, and the markings on the box didn't mean anything to them, and they threw everything in a dumpster. All the shred boxes filled with PHI, right? Fortunately, someone came in and worked at 5 a.m. and they were like, where are all the boxes? You were supposed to go to the shred company, right? They were under people's desks. They grabbed all of those boxes and they said, where's everything? So we went out to the dumpster. We figured out where they were. We actually had a dumpster dive and take everything out of the trash and go through the trash until we had all the PHI sorted to one side, and we put the trash back. And then we, with gloves on and like a mask, I was going through the trash to make sure we didn't have any miscellaneous stuff left in the random bags that we found. So we're very fortunate that it was contained. A large health group, and I'll not name them, but they're pretty large in California, was found liable for a $49 million fine to resolve allegations because they disposed of medical waste, hazardous waste, and PHI at their facilities statewide, right? And so something to think about if you have the clinic in your agency, right? Or you're talking about PHI, it could be on a pill bottle, right? It could be on your labels for a patient or some charts. If you throw out a bunch of empty file folders, what if the PHI is stuck on the folder, right? I've had a situation where people were giving away furniture and PHI got stuck underneath a drawer, right? So there's lots of ways that PHI could be in your trash. So I just want you to, just keep that in mind as you dispose of things. Has anyone heard of phishing, smishing, spear phishing? See some hands. Okay. So phishing is now a very sophisticated means to trick individuals into giving up sensitive information, right? There's email phishing. That's probably the most common, where you get a bunch of emails that are trying to get you to give up your personal information. Smishing is phishing by text. That's coming up more and more. Spear phishing is more targeted, right? It's usually using your name and your role. So if you're the chief financial officer, they might focus on you, send you an email and say, hey, you need to transfer this money to X organization. So they're very sophisticated. Whaling is when you target the CEO or the leader of your organization. I guess because they're considered the whales. Voice phishing is new. It's pretty scary. They can use AI or automated phone calls to call you. Recently, we've had our CEO give speeches, and they took his voice and compiled it from all his speeches and used AI to convert it into a conversation with the caller. So they would get a voicemail from sounds like Moo, our CEO, and says, hey, I need you to buy 10 gift cards and send them to this place. And then people are like, Moo would never call me to send gift cards. Like, this seems like a strange call. And so they reported it, but it's absolutely totally AI generated, and it's a voice phishing call. Clone phishing actually uses a legitimate email that you already have, and they add a malicious link. So it looks like something you normally get, but they might give you a bad link. So be really, really careful. This is how ransomware happens, right? They get in one of these entry points and they get information, or they steal money, or they steal confidential information, right? So you got to be really suspicious. It's maybe not in all of our nature, but you got to be suspicious. Use strong passwords. This is true for home too, right? You can get phished at home. You probably get a bunch of junk email that looks a little funny. You get a sender that you don't normally get, a notice from. For example, if you bank with Chase, but you suddenly get a bunch of Wells Fargo email request about payment or your bank account, you probably know that's not really yours because you don't have a Wells Fargo bank account, right? But that's how they do it. It looks like a real bank statement. Someone might request money. They might ask you for records. Again, this is where if it's a medical record, you got to be really careful. Don't share something unless you know it's the appropriate place. The format might look funny, right? It might be an email from somebody but they don't write it that way. They don't sign it that way. The signature line looks funny. There's a typo. Don't click on links that you don't know. So if you're, clicking on a link within your organization and you're aware of the tagline, it looks okay, or you're used to getting a link from this person and it looks like a file that you're used to getting, okay. But if you get a suspicious link or a link from a stranger, don't click on it. It could be potentially very dangerous. You need to report phishing emails to IT. Hopefully you have a mechanism for doing that. They can block suspicious senders. And then we have a phishing campaign. I hope you do as well at your organization that tests your community and audience on fake phishing emails, right? It's a really great test. if you click it, you get sort of the awareness training about, hey, you've been phished, and then they tell you like, what do you have to do to protect yourself? And we try to work on getting a click rate that's really, really low in our organization. And we've worked on that in the last few years. So it's pretty important if you're able to do it. It's a nice thing to do to protect yourself. Okay, I'm going to stop for a second here again. Do we have any questions about any of those topics? And I'm going to go into like navigating between various agencies and providers. All right.
Miss Emily, we do have a question.
Okay, sure.
About the phishing, which is super common. I'm glad you shared those.
Yeah.
What happens if you are phished? What can happen?
Yeah. Well, obviously, hopefully you haven't divulged too much information. If you've divulged information like confidential company information or non-medical information, that's something you probably want to report to your organization. You definitely want to report it to IT if you've been phished, because it might be infecting the rest of your organization. So you do want to report that immediately to IT or whoever manages your email and your systems. If there's PHI involved, if you have a compliance officer or compliance person, you probably need to report that. There could be access to data that's inappropriate. If you accidentally shared PHI, obviously you would need to report that you've disclosed it inappropriately. There are ways to track where things go. So IT can do some forensics for you. Again, depending how sophisticated the issue is, you may not know for a while that you did that, right? I can speak to a particular phishing campaign where someone was sent an email. So a partner that they know in the community, it wasn't in our company, but it was outside, sent them an email and asked for a report. It looked pretty normal. Somebody they work with all the time, didn't look funny. So they clicked on the link. It created this, storm of spamming emails, right? So all these people suddenly got all these crazy emails, and definitely somebody had taken over that person's account. We as a company had to reset passwords across the organization. So we have 9,000 people, right? So imagine the reset process for that, right? It was several years ago. Luckily, we didn't have 9,000 people at the time, but that's the kind of thing that can be really disruptive to an organization. So there's a couple ways to address it. But again, depending on what's happening, obviously, if you have funds transfer, if you were in finance and you sent money, you obviously need to try to pull it back or stop it. You can report it to the police also. We work with the FBI sometimes if there's a case of significant value. You can also report it to the police. You have a case number. If it's a big enough issue, it's become a big issue, obviously you need to report it if you have cyber liability or to your insurance carrier. So lots of things to do should that happen. Hopefully, your agencies have an incident response program, and cyber attack should be one of the incidents that you prepare for. We know of a couple of large organizations, hospital systems, vendors that we use that have had data breaches. And again, we have to trigger our own incident response to respond to their breach, right? They on their end obviously have to start their incident response program as well. So we used to think about a lot, incident response was just, how do we deal with a fire, right? What do we do in the case of a flood? What do we do if we have, a power outage, right? That's the things that we were dealing with, wildfires. We were dealing with some of those. We don't have internet. What are we going to do? But now cyber attack is a significant incident you should prepare for.
Thank you for answering that. We have a hand up if that's okay.
Yeah.
Ms. Gutierrez.
Thank you so much, and thank you for the space. My question is related to, you mentioned about doing a risk assessment for the organization. Is there like a guide or some kind of like checklist that you can share or maybe suggest to us that we can use as a means to assess the risk in our organization?
Yes, I'm going to provide some resources at the end. There's some risk assessment discussion there and some links to some community resources available based on the Office of Civil Rights. But I'm also going to talk through a little bit about some of the things to consider as part of the risk assessment. You can do a very formal risk assessment, obviously with an external party, but in the context of just trying to make sure you know what you're doing in terms of handling PHI, a general risk assessment that you do on your own can be a good start.
Thank you.
Thank you.
All right, I'm going to jump back right into that because we're going to be talking a little bit about a nice segue. Thank you so much. Let's talk about the risk assessment. Here we are. Things to consider, right? what are the things we want to think about when we're going to start using PHI in our space? If you weren't doing it before, you got to review your process end to end. You should do that on a regular basis, but especially if you start a new program, a new use case, a new system, right? A new healthcare delivery program that has telehealth, for example. So think these are some of the questions I like to ask. You know, what are the healthcare services that are going to be provided? Are they physically in person? Are they through telehealth? Are they through referral? What are the things that you're going to be providing? How's the care delivered? Who has access to the data, right? Is it going to be 5 people in your organization or everybody at reception? Is it going to be all of the managers? Who's going to have access, right? Why do they need it, right? Do people need it for quality control? Do they need it because they were handling payments? Do they need to process it for operations? There's lots of different reasons, but they also might only need some of the data, right? They don't need everything. Think about minimum necessary again. What workflows include PHI, right? You might have whole groups of people that never touch the PHI. Great. They don't need to be trained on it. They need to be aware of it, but they don't have to know all the details. They also don't need to have access, right? Versus other workflows that heavily involve PHI, those are teams that need to be really trained. They need to have physical space that can be secured, et cetera. How's it stored and retained, right? You have retention requirements, storage. You want to make sure physically and technically it's safe, it's encrypted. Where is it stored? If you have a physical space, is it safe? Is it locked? And then what vendors do you use, right? You might have to have some agreements in place, like a business associate agreement. You also need to vet your vendors, right? Right now, if your vendor doesn't do a good job, it affects you and you can be liable for their mistakes. So you want to make sure you're picking vendors that are doing a good job with their security and their protection of data. Okay, it's a lot to think about. But you've got to be practical too. You've got to work in your space that you have. Like you're not going to redesign your whole physical setup, right? So you got to kind of figure out what's going to work in your space. So these are kind of the requirements of HIPAA. Just talk through these really briefly, right? You got to notify patients of their privacy rights and how to use their information. You have to ensure that all the PHI is safely transmitted and managed. Employees have an obligation to apply reasonable safeguards. Again, this is a reasonableness test, right? You don't have to do everything perfectly or to the highest standards. You may not be able to in your physical space, right? But you need to have reasonable safeguards. In an emergency room where we work a lot, sometimes the patient has to be seen in the waiting room or a hallway or even the ambulance bay in the ambulance, right? There are people walking around, right? You might have to just say, you know what? I know people can hear me speak to you, but is it okay if we have this conversation right here so I can see you sooner? Or let's move over to this corner and I'm going to speak really quietly so we can talk about your medical condition without compromising other people. It's not the best setup, right? You don't have a wall around you. It's not completely secure, but again, those are reasonable safeguards. You also want to, secure patient records so they're not readily available to those who do not need to see them. Again, if you've got people's charts or medical records or even release documents or other things, and they're sitting in your waiting room or they're sitting near a space where people are walking by all the time, that's not the best place to store them, right? So you want to make sure you find places to secure things. Overnight, you need to make sure things are locked. You have locked file cabinets or locked spaces. And again, you need to assign an individual to ensure that you're adopting all of these requirements. Make sure you train for your folks on what to do. And then again, protect your data if you have to have an agreement like a business associate agreement. This is very high level. Some of my resources talk about more specifics, and then the Office of Civil Rights, OIG, other HHS all offer a lot of resources about, practical toolkits and sheets to help you kind of walk through what you need to do. So let's just talk about a couple areas specifically. Patient privacy and rights, right? If you keep medical records at your location in any form, maybe not the whole chart, maybe parts of charts, right? You think about accessibility. It's important to know who the certified medical records owner is. Oftentimes, like for example, we have a billing company. They need the chart. They have the chart for a long period of time. We code it, we bill it, we send it out. But we're not the certified medical record owner, right? The hospital is. So if someone subpoenas us for a record, we actually can't disclose a certified copy. We have to direct them back to the hospital to get the official record. Now, would we be subject to the subpoena? Yes, we would have to give them our billing record because that's the portion that we created, right? We're the owner of that portion of the record. Now, for the medical record, again, sending them back to the certified medical record holder, which is the hospital. In all of those cases, storage is important. You need to make sure you have backup, encryption, et cetera. You need to have notices of privacy practices, especially if you are seeing patients and registering them at your location, patient consent, authorizations. There's lots of forms you might need to have people for patients, retention policies, and then you need to have a process for managing a request. So a patient has a right to get a copy of their record, right, at any time, including an electronic copy of the record. If they want to amend their record, they can certainly request that correction. They don't have to be granted the correction if there's a reason they should not, like it's not accurate. Some people, but if there's a correction to be made, they can request that. They can also authorize others to access their record. So this is a case where I think applies to a lot of you. Patients say, yes, you can authorize my record. I'm going to actually authorize you to get my record from such and such hospital, or you're going to tell the hospital to release it to you, right? So there's forms to fill out at the hospital to release that record to the agency that needs it. You might be going to an attorney for a subpoena, other reasons. Access provisioning, right? We talk about who can have access to this record. So again, we a little bit touched on before, if you have employees who are working with medical records or medical information, PHI, identify who needs access to the data, talk about minimum necessary. That can change over time, so make sure you're adjusting that. You have to get user access controls set up with password protocols, so make sure you have nice, strong passwords. You have to have some privacy policies, mandate annual training. I know with the Cocoa Family Justice Center, we actually do the compliance training with you guys. 6 of you have to take our training every year. We work through the policies because you're working in our medical records, right? So that's our partnership with you, is to make sure you do the training that fits our program. There's also a duty to report, right? You want people to address things when they come up without any retaliation. So you want to make sure there's a strong duty to report culture. If you see something that's happening, we can fix it right away. And then we also have that really tight timeline to report in California. You need to protect PHI. Again, I talked about physical safeguards like the space, but also technically. So make sure your systems are really, really secure. Now, what about within the community, right? You can send data back and forth. So you can send PHI by mail or fax, right, to an appropriate entity. You have to make sure you have authorizations on file if you need them. And so you need to make sure everybody knows how to use the forms and train on their use. If you're going to use email, you need to have a secure email option and a good flow for how that works. We actually set up secure email connections between most of our hospitals so that we can have an ongoing collaboration. I think it's called TLS encryption. There's some different ways you can do it. So it's just something to think about with your IT. If you have a partner you're always working with, it is another level of protection. Physician to physician, if they're doing a consult, this is often a covered relationship between two covered entities. They can have that as long as both of them have a relationship to the patient, right? You can't just do it with a random individual physician if they have no relationship to the patient. Other disclosures might require an exception, authorization, consent, or a business associate agreement. I talked about space already, but really think about your space, right? Sound is important. People can hear you in many settings. Don't talk about PHI in the lunchroom, right? Don't talk about PHI when you're in a public open office space, right? These open planned offices are not good for PHI, right? So they look cool, but you actually can't protect sound very well. So for telehealth too, make sure you've got monitors, headsets. The monitors need to face in a way that is not, out to the public. Social media posts we talked about, backgrounds of photos. I love marketing teams, but they love to take pictures all over the place. You actually need to get people's consent, and you need to make sure there's nothing like PHI on the wall, right? I've seen a picture where the patient's chart is behind a group of doctors. We had to edit out the PHI, right? Because it's sitting right on the picture and people can actually magnify in and see that. Files and forms, you need to make sure you have a good place to put those. That's whether it's a locked office or a cabinet. We talked about trash. It's my favorite topic. Don't throw PHI in the trash, right? We want to make sure it's disposed of in a shred bin each night, or that you have a good disposal of medical waste option. Okay, that is space. Let's talk about when you can release PHI, right? We've been talking about how to protect it, but when can you give it out? You do have to use it on occasion, right? So we focus on 3 things: treatment, payment, operations, right? You can use and disclose protected health information for those purposes. Those is the care coordination that we need. Operationally, we need it. Agencies need it for various information. We need it for payment processing, right? Typically, other disclosures will require valid written authorization signed by the patient or the patient's legal representative. CMIA, very similar discretionary circumstances to the right? So the ones on the right are okay, they can also occur without written authorization if, right? If they're required by law, there's a serious threat to health or safety, public health, so communicable disease, right? Outbreaks, you might have to report certain things for a public health purpose. Victims of abuse, neglect, or domestic violence, there are some duties to report. Judicial administrative hearings, you might have a court order, a subpoena. Law enforcement, there's lots of reasons for law enforcement that you may need to identify. I'm going to talk about that a little bit more later too. But usually it's related to imminent threat. There's a suspect, there's a missing person. They may need health information to help verify a crime. So those might be situations where law enforcement may have the right to the information. I had some of these other categories, identifying someone who has passed away, health oversight agencies, donations, research, government functions, etc. Okay, HIPPA agencies. I'm going to talk about law enforcement on the right there in a second, but some of you may be regulated by other groups, right? So HIPPA doesn't always apply for employers, right? Your health information of your employees might be under medical. You might be under the California Privacy Rights Act, for example, but not under HIPAA necessarily, right? So depending on, like, if you're employee-owned health service, that's slightly different, right? If you have your own health clinic in your site, that might be slightly different for those types of records. Law enforcement, police, some of the child protective services, and again, schools are really highly regulated by FERPA, so they have other regulations to consider. So you also might have very specific requirements under a particular facility, right? They usually have a health information management team or HIM team. If you're working with a particular hospital, they have specific policies on how they release information and what their exceptions might be. And then again, on the right, these are some of the things that we talk about for law enforcement. I think this is a tricky area. If a policeman comes in, people feel obligated to just give them everything, right? You actually shouldn't give them everything. We train this a lot in our emergency rooms because our emergency physicians get nervous and feel like, oh, I should just give you everything. But actually, you still need, best practice is to have consent of the patient or some authorization to give out the information. Otherwise, you can give the information in certain circumstances, as I said, right? There's a gunshot wound, there's an offsite emergency, there's a crime in effect, right? Someone's missing. You need to alert someone of a death or a suspicious death, serious threat to health and safety. Okay. So I'm going to talk about two scenarios here. These might be common for you. These are the ones that we work with a lot, right? There's telehealth into an agency that we work with. So if it's Family Justice Center, it could be the housing complex. We have one that we work with in Washington where we have clinical care. We work with a lot of SNFs. So if we're working in a skilled nursing facility, we might have telehealth into them. So telehealth into an agency is one way that we need to think about data, right? There are folks at the staff of the agency, the navigators who work at the social service agencies. They're typically employees of the agency, not of the provider. They need to be trained. They typically are the ones who set up the telehealth iPad or monitor, right? So they need to be trained on how to access our systems. Providers are using telehealth to deliver that care, so they have to be trained on their end. How are they providing that care? And then there's that coordination of things like, I need to enter some data. I've got a chart to upload. I've got managing of appointments. All of that is PHI that needs to be handled. And then the medical records typically housed in the provider system. So there needs to be some authorization, right? What we think about a lot is we need to train everybody, right? There's a lot of things to think about. And if you have turnover in your staff, you have to make sure you're continuing to train people on an ongoing basis. And then they keep adjusting their minimum necessary. What are the things they need to do? And so think about what is the access they need to have. Again, secure email, encryption if you can provide it. And then again, if you need an agreement like a business associate agreement, you have it in place. That's sort of telehealth into a space. Now, what if you have a clinic in your space? Like we do that actually at a couple places where we actually have a clinical space. It might be a room, it might be a side of a building, it might be part of within a complex like the housing complex we have in Washington. There we do telehealth and we have in-person care, right? So in that project, We have a nurse who's an agency employee, so they hire the nurse. They own the clinic. So in that situation, our providers are staffing the clinic. We treat via telehealth. We also come in some, but that clinic setting, we help work with them on setting it up, right? You have to have all of the clinical requirements. So, notices have to be set up, signage, documents for patient privacy notices and notice of privacy practices, consent to treat, all those things have to be set up. The medical records owned by the agencies, they have to have an EMR, they have to have a way to retain it. So all those consents, authorizations, requests for information processes have to be managed by the agency. Typically in a project where we work with a social service agency, we want to help them succeed. So we do work with them on how do you create the best policies and procedures for that kind of service. And then we have them review them with their external counsel. And then again, in that situation, we're staffing them. So the providers are sort of going to work within the agency's rules there. So two really different scenarios, right? But those are the ones that we've seen most commonly. People ask me all the time, does HIPAA apply to this? Does HIPAA apply to this? So I'm going to run through a couple of these to see if you can think about it a little bit differently, right? Referral to a hospital from an agency. There's no records exchange, right? You're sending someone to a hospital, you're sending someone to an emergency room. You don't have to have, there's no HIPAA exchange right there, right? But if you want to send a medical record at a patient's request to somewhere else, of course, you need an authorization on file, right? Same thing, that patient comes back from the hospital now and they're in your agency, but they ask you, can you get the hospital to send my discharge summary? Well, you can only do that if they have an authorization on file at the hospital, right? Or the patient can access their own record and give it to you, right? That's their right as well. But you can't just call on their behalf and get the record for them. Care coordination between providers, I talked about that. If you are consulting on a patient, you can consult if they're both your patient, but if they're not, you probably need some other authorization. And then coordination between agencies, it depends on what the nature of the relationship is. HIPAA doesn't always apply between agencies if there's no medical record. If it's some other regulation, it might be covered by that. Sending data, again, government's pretty late on requirements. They're not up to speed. So fax, FedEx, or mail is their preferred method still. Secure email. Again, if you're going to use email, make sure it's encrypted. You have ways to manage that. Be careful with confidential diagnoses. If you're doing psychiatry or psychotherapy, you don't want to share that information. Regardless of the authorization, be really careful what you're providing in those contexts, and then send the minimum necessary. And I hope everyone's learned my mantra, which is verify, verify, verify. Make sure you check every element before you send something. Okay, so we've done a lot today. I just wanted to talk again about, the culture of compliance begins with trust, right? We're starting with protecting our patients. We've covered a lot, but again, it's about training. It's about taking that risk assessment, making sure that you're covering all the common pitfalls, and having a right, do the right thing attitude. That's really important so that you can foster that culture of compliance. Make sure you have a duty to report that's available so you can fix things that go wrong, and that you have non-retaliation so that people feel comfortable reporting. And here's the key, right? Nobody knows everything. So that's, you have to think about that all the time in any context, right? But get support when you need it. Get external counsel, get collaboration with your other agencies, get support from the provider group. They probably already work in that situation a lot, so they might have some experience. And finally, HIPAA is just one law to consider. So you might have other regulations and obligations in your agency. So, I could talk about HIPAA today in a very general context, but I certainly can't speak to all the other laws that you might have to follow in your space. So I'm going to leave you with some resources too. These are some links to some basics. Some of these are more specific on breach notices. There's others for resources, providers, and then some understanding of the HIPAA guide, so to speak. Once you go into those links, there's so many more resources you can access. There's also some great resources in the letter that I linked related to the ransomware attack. The Office of Civil Rights put a whole bunch of risk assessment related links into that letter. So if you click on that letter, you can actually open up a whole bunch of other resources for you. Finally, I just want to thank you for the very inspiring work that you guys do every day, right? I appreciate the community that's on this call. I would love to visit again. You guys have just an inspiring body of work. And so thank you so much for having me today. And I'm certainly available for questions, and you can also share them with me at emily.zahn@vituity.com.
Thank you, Miss Emily, so much for the presentation. I learned a lot, and it was a really great refresher for me and the work we're doing here with telecare. We have two hands up. Ms. Gutierrez, go ahead, and then Susan.
Thank you so much. You've talked a lot about transferring of information between clinics or providers and things like that. The organization that I work for is actually considered a clearinghouse. And so my question is related to actually, so sometimes we have a model in which sometimes the patients are seen on a Saturday in person, and we as staff are present. And so I'm wondering if listening to what you're saying, if it makes sense that we should make it a point to, at those events, make sure that the patient signs a medical release form at the hospital that they're at, so that when the clinic wants to request their medical records, that's already on file.
Yeah, I think it's something to think about. If you have a common workflow that's going to require the same paperwork being filled out all the time, it's something you can ask of your patients in advance. We do that at some of our clinics. If we think we know they're going to be using an authorization, we try to flag that for them early on so that you've captured that.
Okay, great. And then my second question is actually related to marketing and media consents for photos and things like that. And so we do encourage our patients to share their testimony. It helps us to increase funding, to just create awareness, to recruit more volunteers to do the work. We generally have a media consent form that we have them fill out. I guess my question is more related to, like, do we need to be specific on the form for the patient to say, you can use my name, but, you know, like change my first name, or you can use my photo, and like, because we don't have those specifics necessarily on there. And so I'm wondering if that's something that we might need to do.
I can't give you legal advice, so I'm going to start with that, but I will share that in general, most consent forms aren't that specific, right? But typically, if you're going to post something about someone in a public space, our practice, for example, is that we run that post by them in advance. We make sure that they approve that. So if you're going to have an event and you're going to take pictures, that's a little more general, right? There might be a lot of people in the photo. You're getting their consent when they enter an event. That's typically how it's done. But if you're going to quote someone, or you're going to write about their testimonial, you probably want to make sure that they approve what you're going to post on their behalf with their name. If they don't want their name, it could be anonymous, right? But again, that's typically how I've seen it done. You can check with your legal counsel to make sure that they approve of that, but that's generally how it's done. It's hard to get the specifics in advance because you just don't know.
Right, exactly. Okay, thank you so much.
But yeah, if you're going to film a video for marketing purposes, for promotions, obviously we do that as well. We need to make sure that testimonial has been approved and that that patient has consented to that.
Thank you. Susan?
Yeah, thank you so much for your presentation. It was really well organized and concise. I appreciate it. I have two related questions. One is that, HIPAA applies to healthcare providers, and you mentioned that there are other privacy laws that apply to other types of organizations. And you also mentioned the educational institutions, they have their own set of laws.
Right.
But a lot of us here in this space are more like social service organizations that do not necessarily provide health care. So if you're aware of any general laws, I think it'll be great. And I don't know if your resource that you cited also would take us to these other types of laws that would apply to social service agencies. That's one question. And related to that question is, actually, our Family Justice Center has a mental health program within it, right? So we are multi-service agency, and we have the mental health support that would, be subject to HIPAA. So, like, how would you approach the setting of these multi-service agencies where you actually have healthcare as well?
Yeah. I don't typically speak on the privacy application to social service agencies. I typically think about the interconnection between HIPAA. So you may not be completely impacted by HIPAA, but you do actually access a lot of medical records. So we typically work with a lot of vendor partners and agencies that are business associates of Vituity, who are the providers, but all those downstream agencies that handle PHI also are beholden to HIPAA. But there are certainly resources about FERPA, COMIA, and CPRA. I can see if I can pull some for you guys, but that's not really what we typically focus on, given our work. For the locations like Family Justice Center, where you have two things, that's like the clinic that we have in the housing project and at Family Justice Center, right? You're doing healthcare within an agency. And so does everybody at the housing complex, for example, need to be trained in HIPAA? Actually, we don't do that, right? We might give them general information and they know there's a clinic there, but the clinic staff's still responsible for that physical space. It requires that segregation of duties and location, locking of that space, right? How's the workflow? Do people walk by that space all the time, or is it at the end of all these things matter, right, in your setup? And so we do counsel folks to have sort of treat it like any other clinic. Even if it's inside an agency, it has to have all of the requirements related to that, even if it's telehealth, right?
Thank you. That's really helpful. And I think we have Jess, who's probably going to ask a follow-up question, Lasha, right? She's from our clinical program.
Okay,
Yes,
great.
please go ahead, Jess.
Hi, yeah. So just to clarify, so being a mental health provider doesn't mean that you're automatically HIPAA covered entity and everything. So we are technically still not, as far as all the research and consultation I've done, but we do work with Vituity, and we work with Familias Unidas, who are HIPAA compliant agencies, and so we do have to adopt certain standards because of that. But I think it's also like a good practice to follow as many HIPAA standards as possible, no matter where you are when working with clients with sensitive information. But is there anything else that we should be considering with that special relationship, or does everything that I say sound like that's what to your knowledge too, that sounds appropriate?
Right. I mean, you're still working with psychiatrists, I think, from our collaboration, right? So you're accessing HIPAA. Once you have that sort of entered into your relationship, you do have to start keeping that security and coverage protections in place, no matter what you're doing, right? You're also working with the same vulnerable population that we do typically in an emergency room or urgent care, other settings, right? So protecting their privacy is pretty important. California's Privacy Rights Act, if HIPAA doesn't apply, that does apply, right? So it applies to things on your website, how you manage their data, where you secure it. So some of those same protections, very similar to HIPAA, would apply for individuals' private PII, so protected, sorry, I'm blanking on the definition, sorry. Personally identifiable information, so the PII that they have. So again, you're going to be covered by a lot of these different regulations, but a lot of the safeguards that we talked about work no matter which one you're applying.
Thank you so much.
Yeah.
All right, any more questions or comments from today's training?
Is Dr. Francis here right now? Maybe we could invite him to share his thoughts or questions if you have any.
Dr. Francis.
Yes, absolutely. Emily, thank you so much for joining us today. This was a very important presentation into what we do here in Contra Costa County. And we are venturing into a unique world of being able to extend the reach of healthcare to patients who were otherwise very remote and had few options to acquire healthcare in Contra Costa County via both telehealth and the network of the Family Justice Center and social services agencies that Family Justice Center partners with. So I'm thrilled we're able to work in this space, but anytime you're venturing into new territory, we need to do so in a compliant manner and make sure that we cross our T's, dot our I's, and define the space appropriately. And I appreciate you working with us to do so on a regular basis. We communicate all the time.
Yeah, Dr. Francis has me on speed dial because he's got questions all the time.
Yes, he does definitely venture out into many wild spaces. And also want to mention that we have people from Solano County in this space, Dr. Francis. So our telecare services are also available for Solano County clients. And he's also looking into expanding telehealth, telecare services for other areas, for those of you who are not in Contra Costa County here. So LaSharia, it looks like we could wrap it up, maybe stop recording, and what do you think?
Yes, I think we can stop the recording. We did